Hello, everyone, and welcome back to the world's best investing podcast. Today, I want to talk about why HIMS may evolve into the most valuable subscription service on earth. It seems a little bit much to say, but honestly, if you look back in my track record online, you will see that most of the things I say people think are too much initially, and then they do happen. I've been rather successful over the past few years. If you're wondering why you should listen to me, well, I'm up 18x on Palantir, up nearly 7x on Spotify, up 3x on HIMS. So I know my stuff. And guess what? I'm not going to go out on the internet and say stupid stuff just to seek attention for it not to work. I only really make money online if I basically have people listen to my calls and then I get them right. That's really how I monetize the audience, right? So I could just shut up and look, I'm up 3x on HIMS and I think I'm going to be up 10x soon and more. And I could just shut up and say, this is just a great healthcare company. But I'm going to go out on a limb simply because this is what I think. And so here's the starting thought for today. If people pay something like a few $100 per year to listen to music or watch shows, how much are they going to pay for a subscription that makes them more muscly, smarter, sleep like a baby, have better sex, be more social, smarter, all while maximizing longevity, meaning you reduce the chances of dying? So the answer is an order of magnitude more at least. It gets very, very valuable. If you look at HIMS's average revenue per online subscriber, it's trending up very fast over the past few quarters, and that's driven by GLP-1s. But GLP-1s are a type of peptide, and the body has thousands and thousands of types of peptides. And these peptides have specific functions, which are wonderful. I'm a peptide user. I'm currently doing a metabolic peptide stack coupled with sermorelin. And what I feel is I'm gaining muscle faster, I'm losing fat, and mentally I feel very, very sharp, much sharper than ever. And I can tell just by talking now, I don't think I would have been capable of talking like this, on the fly, improvising, just retrieving information from the back of my mind in this manner, right? So the point is that actually HIMS is building the infrastructure to essentially deliver a subscription service, which is going to be something like not dying as a service or being healthy and optimized as a service. So there's a number of fundamental implications here. Firstly, it basically tilts the healthcare industry on its head. It goes, the healthcare industry is reactive, it sucks, it has no customer centricity, and HIMS is shifting that model towards you don't even get sick, this is highly customer centric, it's cheap, it's effective, it's convenient, etc. So it's a little bit like if people, it's the current situation we have now is like if people, instead of having Amazon and pressing a button to get whatever they want to get online, they would have to jump on a donkey and go through these tremendous mountains with very bad weather, and then eventually at the end of that journey get whatever product they want in some taco stand that's at the other side of the mountain, right? And so that's kind of the evolution that we're going to see with HIMS. Why? Because we basically are living through the advent of precision medicine, meaning that we now have the technology, and increasingly do so as AI continues to compound and biotech continues to get better, to not get sick. We're talking about this happening in maybe the next 5 to 10 years. I think in the next 5 years, we're going to see an explosion with peptides because, and this is just per my understanding of HIMS as a business, right? In terms of why I think it's going to do so well with or without peptides. And then with my experience as a peptide customer, I just think these molecules are fairly miraculous. They have an incredible safety profile because these are molecules that your body produces anyway. So it's not petrochemical drugs. So I think we're going to see an explosion. It's going to be phased. But eventually, I think precision medicine shifts the whole industry on its head, and HIMS's subscription becomes something that's essential. So we think Spotify and other apps like that are essential to people. Over the past 3 or 4 months, when analysts were, they were sending out emails saying, I'm kidding about this, but they may have well been doing this. I hope you're doing well in these recessionary times, kind of like during the pandemic, right? People were so convinced we were going to see a recession, and people were saying these two companies. I don't want to mention them because YouTube doesn't like me mentioning competitors. This algorithm is a little bit nasty, to be honest. But they analysts were saying these were a recessionary hedge, right? So you would think these are indispensable, but then think about this. If AI continues to compound in this manner, and biotech continues to compound as it's doing now, and AI is largely an enabler of biotech, by the way, which you can learn about in my Appcelera deep dive, we're going to reach a point where precision medicine basically enables us to navigate the human proteome real time on an individualized basis, so that whenever something's happening inside your body at the molecular level, which has meaningful odds of creating illness, so malfunction at the cellular molecular level is after cellular, of course, then it basically sends a message to the system, that would be HIMSS vertically integrated infrastructure, so that HIMSS sends you molecules with a specific shape and thus a specific function to stop the illness at its tracks. So let's take a step back and consider the following. Basically, the human body is a giant Lego puzzle, meaning that we are just a proteome at some level of abstraction, and each protein has a specific function which determines its shape. And per electromagnetic forces, weak electromagnetic forces, these proteins just bind onto proteins with an inverse shape. It's like Lego. And that is, on a first principles basis, how every biological process works. And that is how life is sustained. So illness is really, it emerges from the cellular level, in that the cell is going to print a protein that has a shape which basically shouldn't have, right? So if a cell stops working properly, it's going to print a protein which has an erroneous shape, and that's going to unchain some sort of a process at the body that's going to lead to illness. Okay, so if we had a personalized real-time digital twin of our proteome, say slapped on our wrist, or not even, maybe by some implant or something, and we had this exhaustive information about what's happening inside our bodies at the molecular level, then we could fix any illness, as I was saying, by just inserting a molecule or a set of molecules, proteins probably, with specific shapes. If you want to learn more about the proteome and how shapes determine function, etc., go and check out my AbCellera deep dive. It's a fascinating company. The worst thing you're going to get out of reading that deep dive is learning a lot about biology. But anyway, the point is that as we move towards that future, eventually what's going to happen is that obviously all the underlying technology gets relatively commoditized, as has happened with smartphones, etc. And then the value accrues to the network layer, meaning that once you have these personalized digital twins, or whatever we do end up having, and then you have that biotech infrastructure which just prints molecules of specific shapes on demand, at scale, etc. The value is just having the data, meaning, do you understand what treatment works for who? And basically the value, of course, is at the unitary level, in terms of if you produce digital twins of the human proteome, that's valuable. But it's even more valuable to understand these digital twins at the network layer, meaning how is the population in this geography doing? What treatments do they respond to, etc.? What are the tendencies in this area? How do we optimize, etc.? So think about it this way: with Amazon just has data. And so they optimize their infrastructure and they yield better outcomes for participants in e-commerce, for both sellers and buyers. So with HIMSS, it's a little bit the same. And if you take that reasoning to the limit, which is, all of that gets commoditized, and we eventually have an exhaustive understanding of our proteome in full time, this becomes a subscription from HIMSS, which basically enables you to stay alive. Along the way, over the next 5 to 10 years, it's the subscription means, is your health optimized or not? So that's why I believe it can be so valuable, right? In terms of, as I was saying, today people pay quite a bit of money for subscriptions which are just about entertainment. How much would I pay right now, for instance, for a subscription which makes peptides really easy for me? So look, I paid $500 for a practitioner for a half an hour call, and then some maintenance during 3 months, but we barely talk, basically. So bringing this back to the present, just to make it tangible, I hope you understand that this is the future we're looking at. Why is HIMSS building the building blocks for this? Because they recently just acquired a peptide manufacturing facility and an at-home full body testing kit company, right? So this is the beginning of precision medicine. You've seen them build an infrastructure by which they have a growing volume of users and they solve a growing volume of treatments, and they do this very well while producing cash. And this is the first time it happens in history in the US healthcare market, and certainly anywhere else. And so if you project their ability to execute with these two new acquisitions, what's going to happen is they're going to bring precision medicine to the masses. And so you can think of GLP-1s, their format of GLP-1s, in which they monitor side effects, etc., as precision medicine 0.1. And you can think about these two acquisitions, so the peptide manufacturing facility and the full body testing company as version 1. So if you project the subsequent versions out into the future, what you eventually have is just a radically deepened understanding of what's happening increasingly at the molecular level for every patient on the platform, and then this increasingly precise manner to treat the condition and eventually get to a level of precision that's preventative. So as I was saying, the value accrues to the network effects, meaning that the technology that HIMSS is going to use there is going to get commoditized. Smartphones today are commoditized, planes are commoditized, relatively speaking, of course, but the value is in them having all this data about all these patients, in order to understand how to best optimize outcomes for patients per dollar spent. And so I think that Q1 financials are very good, as I talk about in the newsletter in the written format, but it doesn't begin to capture the opportunity. So again, the key metric that you want to be looking at is average revenue per online subscriber, doing very well over the past few months, driven by GLP-1 and weight loss. But what happens now is that as HIMSS scales peptides, the subscription becomes something that everyone wants to talk about, everyone wants. So if you think about somerelin, one of the peptides that I'm doing for muscle growth, it's actually not for muscle growth. It's anti-aging, but one of the side effects is muscle growth, and very happily so for me. But who's going to be able to shut up about that? No single dude that goes to the gym is going to be able to shut up about it. So this changes the unit economics for HIMSS in terms of cost of acquisition and lifetime value. In that, you obviously, as an early HIMSS customer, you didn't want to tell people about the conditions that you were treating because they were stigmatized. Or if you're very open-minded, you didn't mind, but the majority of customers didn't want to tell people about that. And if you go on a muscle-enhancing, fat-losing, intelligence-enhancing, sleep-enhancing kind of thing, then you just can't stop talking about it. So last quarter in Q1 2025, we saw organic growth picking up, and we saw average revenue per online customer picking up. So I believe that's a preview of what's happening. But I don't think people understand that what we are seeing now is HIMSS laying the foundation for precision medicine. That precision medicine is going to pick up exponentially over the coming few years, because with peptides, you can enhance your health so much. And I wish you could try this, because for me, it's been incredible. And then simultaneously, as AI compounds and biotech compounds, this is heading in a direction in which the subscription becomes so much more valuable. And if you project it out into the future, and there's obviously a lot of risk, there's no guarantee here, right? Like there was no guarantee with Palantir at $7, but that's why we have a portfolio, and that's ultimately why I'm not your financial advisor. I'm just a dude that makes investments on the internet. But if you project this out over the long term, what you end up is really with humans living much longer, and doing so based on a subscription, because it's just a lot more comfortable and it's a lot more convenient. So if you want to do all these peptide things on your own, etc., you have to have suppliers. I live in the EU, and it's obviously incredibly regulated, so I have to have these special ways to bring in the peptides. I'm doing all the injections myself. I have to buy the syringes in some place. I have to buy the bacteriostatic water in another place. So it's very inconvenient. And I'm actually not measuring my outcomes often enough, meaning I should have this incredibly convenient way of just measuring what's happening inside my body on a monthly basis. And I'm not doing that at that frequency. And perhaps you could argue that you should be measuring it on a weekly basis, maybe. So whichever infrastructure just aggregates all the tech that's compounding and makes it really easy, convenient, and cheap, then they get the data advantage, which enables them to train the best medical AI, essentially. And basically, that AI enables them, the network HIMSS, to optimize outcomes for every single stakeholder in the network. You as a patient, practitioners, providers of various technological gadgets, providers of the molecules of varying shapes, etc. So with the $1 billion raise that HIMSS has done today, I think that the thesis has become rather de-risked, because we've already seen companies like Amazon and Walmart failing to get into this business. And that's because of the extraordinary execution. Frankly, this is just an extraordinary management team. This is all there is to it. Now with $1 billion, I mean, these guys have built a $13 billion, $15 billion company with zero cash. Now that essentially zero cash, now that they have $1 billion, well, I think it's going to be tremendous, what these guys can do. People have a little bit of PTSD with Teladoc, but it's not any company that raises $1 billion and happens to be in healthcare is Teladoc. It comes down to identifying great management teams, and essentially an extraordinary track record of executing. Q1 2025 doesn't give me any reasons to doubt this company or the management team. So I'm very, very bullish on this. And just talking again about my 2030 intrinsic value target, well, the first thing is if it goes below, then no one, but it's directionally right, then no one really cares. I mean, if HIMS ends up being a, say, $800 stock by the year 2030, then who freaking cares, right? But I think that actually this is going to be exponential because, I mean, the building blocks are in place for healthcare to evolve very fast and for people to want it and for HIMS to deliver it. Meaning that, I mean, the people that I tell peptides about, they don't do it because they find it really scary. You kind of have to be a little bit of an eccentric guy to do this at the moment. But the outcomes are tremendous and the safety profiles are exceedingly high. Like ibuprofen is more dangerous than most of the peptides, certainly the ones I'm doing. So I think people are really going to want this. And then the long-term view is a little bit dystopic, maybe, meaning, I mean, it's literally, say by, in 20, 30 years time, maybe you have this subscription which keeps you alive because you have the proteomic digital twin. It even maybe goes deeper at the cellular level and monitors what's happening at your DNA, which, by the way, I'll talk about this sometime, but I've had some experience with bioresonance machines, and I suspect that a miniaturized bioresonance machine could be the future of this thing. The bioresonance machine basically checks for the frequencies that your body is emitting. And so the healthcare establishment will say it's pseudoscientific, etc. It's not. It works. I've tried it. I've seen it being used on a lot of people. What happens is that every molecule in the body has a specific frequency. So this machine can tell whether that given molecule, protein, organ, set of organs, etc., is vibrating at the correct frequency or not, and is therefore a highly effective diagnostic tool. I think I'm going to get banned for this. Hopefully not. But anyways, I think that's the future. And I think I'd be very interested to see whether someone could miniaturize that, because I think that's the most effective technology to do a real-time digital twin of the human proteome. I think it's actually very feasible even today, because these machines are fairly large, but I'm sure they can be miniaturized. But yeah, that's just my experience. To be honest, as I'm talking about this is the thing that's most capturing my mind right now. Because on a first principles basis, that technology can be miniaturized and it's so effective. Some of you, I guess like maybe 0.1% of you, if at all, have any experience with this machine, but it's so interesting. And then you can obviously put, I mean, all the recordings that the machine does of frequencies, you can just probably shove it into some kind of pandas framework and then obtain the data in real time and see what's happening. Definitely much better than what we have today, which is you walk into a doctor's office and the guy has no idea and he's typing away and he smokes and drinks Coca-Cola and doesn't fix you or whatever you have, right? So anyways, I think that we see exponential progress over the coming 5 years, certainly 10, 15. No guarantee that HIMS is the winner that takes all at the network level and therefore obtains the data advantage. But so far, this is the winning horse. I've done very well selecting this early. A lot of people on X selected this earlier, which is very impressive. Some people were in the stock since the $5 level. I'm in since 15. So yeah, not financial advice. Today I've rambled a little bit more, but I think, I mean, honestly, guys, you got to check out the bioresonance thing. It's just fascinating. I've been thinking about calling the company that makes them in Germany, and I think I will. But anyways, version 2.1 of the course is launching this week. It's whenever I add something to the course, I try to add key components that I think are going to cascade down into existing components to make it much more powerful. We did that with the algorithms. We now have a new concept that I'm going to be breaking down, and I have a very, very special surprise coming in for the course. And let's just say that I'm going to be much more present with you guys as we go through it. but it's not going to be me. It's going to be an Iron Man suit that are programmed to. No, I'm kidding, but it goes along that line. Anyways, guys, thank you so much for joining me. As always, if you enjoyed this video, could you please share it with someone else who's willing to listen to me ramble for 20, 30 minutes? And take care and see you next time.